time to head down to the... where are we going again?
The emergency department.
Oh, yeah. The emergency department. Now, come on, Chris.
It's that way.
At the emergency department in Liverpool, 7-year-old Ava is waiting with her mum.
What have you hurt, Ava?
Me hand.
Ooh, your finger's looking swollen. How did that happen? Ava was happily jumping on her trampoline with her mate Chloe, but it all went wrong with the crab.
It was that wicked pirate, Pincers O'Krabby. Oar.
I'm not sure.
It was. Listen up. I've had a proper thinky. I know how she hurt her pinky.
No, Xand.
Ava was doing fancy landings, so amazing at the old handstanding.
Stop!
In came the crab with his pincers
no
ready.
pincers O'Krabby.
Oh, all right then.
Ava went from a handstand into the crab gymnastics move, and she bent her little finger back. Ouch! You won't be doing that again in a hurry, will you?
The dogs have sent Ava straight to X-ray to see if there's a break.
Get ready for your close-up, Ava.
Fantastic, Ava. That's you all finished, okay?
Thank you.
Time to find out what the damage is.
I'm really nervous.
Well, don't worry. Here's nurse Jenny Cardis.
When it comes to fixing fingers, she's a dab hand.
Here's Ava's x-ray, and looking at her x-ray in this view, you can see that she has a fracture to her middle phalanx of her little finger. You've got a little break to the middle bone there. So I think I'd like to get her assessed tomorrow morning, if that's okay. The plastic surgeons will assess her and they'll decide whether or not she needs some kind of intervention and maybe surgery on it.
Ava's little finger is temporarily strapped up, and she'll be back to see a surgeon tomorrow. Bye, Ava.
Bye.
Next morning, she's back. And here's Surgeon Pundrik Sama to look at this dodgy digit.
If we follow the edge of the bone, boom, something not quite smooth.
So, does Ava need an operation?
I don't think everything's bent sufficiently out of shape that we need to do an operation.
Phew, no operation needed here.
But you do need a splint and cast.
Any final questions?
What's your favourite TV programme?
Obviously Operation Ouch, Ava.
That's the correct answer.
Yeah.
Thank you.
So that's this one all wrapped up.
It feels weird.
Or is it?
Bye.
Find out later on.
And now to our lab.
It's time for some big body experiments. Some of them gory,
This is not for the squeamish.
some extreme.
It's freezing!
We're ready. Are you?
Just don't try anything you see here at home. Today, we're looking at your eyebrows.
Xand, what are you doing? And what is on your face?
Do you like my new look? I thought I'd see if longer eyebrows suited me, but to tell the truth, I'm having a little trouble seeing anything. I can't find the mirror.
I mean, you can look if you want, but I promise that you look absurd. And there's actually a good reason why your eyebrows are the length they are, and it's largely to stop them getting in your eyes.
These aren't exactly practical, but if I style them a little bit...
Did you know that every hair on your body has a set maximum growing length? Now, some of the hairs on your body, like your eyelashes or eyebrows, will have a much shorter maximum length compared to the hairs on your head.
So unfortunately, I'll never be able to grow my real eyebrows as long as this, which is a real shame. And in fact, however long you try and grow the hair on your head, it will only ever get to its maximum growing length too. And I have just the sample in the cupboard of everything to prove it. Now what I've got here is an amazingly long hair sample. Look, it's 110 centimetres long.
Honestly, Xand, you have to start giving your samples their proper names. This is Anisha.
Yeah, Anisha, sample, whatever.
Now, Anisha, how long have you been growing your hair?
1 year.
Wow, Anisha's hair grows as fast as Xand's eyebrows. We can tell what growing stage your hair is at by looking at one under a microscope. I need a sample.
Anisha, would you mind?
Sure, I've got this, Chris.
Wow!
Here you go.
Thank you.
What was that for?
I needed a sample.
You're the sample.
This freshly plucked hair from Xand's head is still in the growing stage.
It has a very dark root.
This is where the cells are busy multiplying, making the hair grow longer and longer.
For some of the hairs on your body, like the ones on your head, this can last for up to 5 years.
Well, for other hairs on your body, like your eyebrows, it lasts for just a few months, always keeping them shorter. Right, Anisha, I think we need another sample.
Oh, no, you don't.
Don't worry, Xand. We'll just grab one that's fallen out already onto your shoulder.
Here you go.
This hair fell off Xand's head. Unlike the freshly plucked hair, there are no live cells around the root, so they're no longer multiplying like this one.
This shows us the hair is old and stopped growing long before it fell out.
Every hair on your body has a maximum growing length, and your body is amazing at knowing which hairs should be longer than others.
Which is why your eyebrows should never, ever get into your eyes. Anisha, would you mind?
Sure.
Ow! Get back in the cupboard.
Xand!
So your eyebrows will always be short, but have you ever wondered what they're actually for?
Ta-da!
Xand, what have you done now?
I'm just getting ready for our experiment. One of us needed to not have eyebrows, so ta-da!
Oh, well, good job. Wait a minute! Is that my bathing cap?
No. This is the Dr. Xand patented eyebrow eliminator.
Why is it blue?
There was a mix-up at the factory.
Throughout human evolution, we've lost much of the hair on our bodies, but our eyebrows still remain.
Now, scientists argue that one of the jobs of eyebrows is to keep rain and sweat out of our eyes. But is this true?
To find out, I'm going to drop water over Xand's head as if there was a massive rainstorm or he was very sweaty.
Oh, that's very unpleasant. It doesn't feel like it's flowing down my face in the normal way.
And what will happen with shampoo?
It's very peculiar.
No eyebrows means the liquid flows straight into my eyes. But any good experiment needs a control, and in this case, the control has to have eyebrows, which means it's you. So it's Chris's turn. Let's see if having eyebrows does a better job of protecting his eyes.
It certainly feels like most of the water is being guided off here and running down the side of my face.
You can see that Chris's eyebrows are diverting the water flow around the side of his face.
Whereas poor old eyebrowless Xand had liquid running into his eyes.
And now, the final part of the experiment, the shampoo.
No, it didn't keep the shampoo out of my eyes. That really stings.
So, eyebrows were good enough to keep water out, but they failed miserably with shampoo. Eyebrows are not 100% effective.
Can I have a little water rinse, please?
We've shown you that every hair has a maximum growing length, so certain hairs like eyebrows are stopped from getting too long.
And we've shown you that your brows are very good at protecting your eyes from things like rain or sweat. But they're not perfect.
But we've kept them for another important reason. They're really useful at making good facial expressions and communicating with other people.
We're both ouch and about.
I'm hitting the wards with my ouch bleeper.
Have you got a question for me?
And I'm hitting the streets to answer your medical mysteries.
At the hospital, Xand's busily playing tennis.
I'm about to beat Dr. Chris's record. 97, 98, 99. Oh no, a bleep! Ah!
You'll never beat my record. Get to your first call. It's from Mohammed, who was rushed to hospital after he fell onto some railings.
Hi, Mohammed, how are you?
Good.
Now, have you got a question for me?
How does my windpipe work?
What's the diagnosis, Doc?
Sounds to me like a case of, I'm Mohammed and I want to know how my windpipe works-itis.
That's a mouthful.
The medical name for your windpipe is your trachea, and it runs from the back of your throat down and splits in half and goes into each of your 2 lungs. Now, the windpipe has one very important job. It has to not collapse. So your windpipe is made up of a tough stuff called collagen with cartilage rings, and the cartilage rings keep it open and stop it collapsing. So even if you squeeze your throat a little bit, you can't collapse your windpipe, so you've always got air going into your body. But you did more than push on it, didn't you, Mohammed? I mean, you actually jabbed a hole in it with a fence.
It hit my throat, under my throat, then I had a small hole.
Now, what kind of ambulance did you get?
I didn't get an ambulance, I got a helicopter.
You got a helicopter?
Yeah.
Do you know what they did in hospital then?
Stitched me.
And so now the hole's mended, you've got a bit of a plaster on there.
Yeah.
And how are you feeling?
A little bit good.
Well, you have done a brilliant job and you have earned an Operation Ouch sticker. Thank you very much indeed.
Thank you.
Thank you, bye.
Thank you. Bye.
Meanwhile, I'm out and about on the street.
Dr. Chris, I've got a question for you. Why does brain work and why do you have thoughts?
How does the brain work and why do we have thoughts? That might be the hardest question it's possible to ask anyone. What your brain does is it's a way of taking in information from all your senses, so from your eyes and your ears and your skin and your mouth, and then your brain decides what to do with that information and controls your body. But why do we have thoughts? No one knows the answer to. So to answer that question, you are going to have to become a cognitive neuroscientist. Do you think you could do that?
Yes, I'll try.
You'll try. Good for you. Here you go.
Back with Xand, another call's come in. It's from Kate Lou and Ella, who are visiting their sister in hospital.
Hi, Kate Lou. Hi, Ella. How are you doing?
Good.
Have you got questions for me?
How come I've got a bigger mouth than my sister?
What's your question?
How come I've got eczema and my sister hasn't?
What's the diagnosis, Doc?
Sounds to me like a case of I want to know why I've got a bigger mouth than my sister, and my sister wants to know why she's got eczema and I don't. Itis.
Now that's a record.
Let's start with your big mouth. Show me how big your mouth is. Wow, that is a big mouth. So everyone has different sized mouths, and most of that is about your genes. Everyone gets a slightly different combination of your genes, but even Dr. Chris and I, who have the same genes, we should be the same in everything. Actually, one of us would have a slightly bigger mouth. I just don't know which. Okay, eczema. Why have you got eczema and your sister doesn't? Well, some bits of eczema are genetic, but you don't have all the same genes as your sister. You've got a few different ones. But also, everyone grows up in a slightly different way. So all the other things in the environment that cause eczema, like which germs you're exposed to and what things live on your body, they'll all be a little bit different from your sister as well. Have I answered your questions?
Yeah.
You have both earned Operation Ouch stickers.
Thank you very much.
Bye.
Bye.
Job done for today. Clinic closed.
Remember Ava? She had her finger fixed in the emergency department.
And now she's back.
Ooh, she's hurt her back.
What? No, she hurt her finger.
Why'd you mention her back?
What, she's back in the emergency. Let's go find out how she's getting on.
Earlier, Ava came to A&E with a very painful pinky.
Ava was doing gymnastics on the trampoline with her friend Chloe. She went from a handstand into a crab and she bent her little finger back. Ouch! Ava's x-rays showed it was broken, so her hand was put into a cast.
Perfect. That's a job done and dusted.
Not so fast. 1 week later, Ava's back.
It really hurts with the cast on.
And here to help is advanced nurse practitioner Simon Minford.
Take it off and have a look and see if it's okay.
Sometimes casts are just a bit too snug, so they need to be removed.
Do you know what you can do now?
Itch.
Yes, please.
Thank goodness.
It's a good job they don't have Ponga vision.
Phew-wee!
What's next, Nurse Simon?
We're going to give her a bespoke plastic finger splint that will still keep her hand in a good healing position, but also not quite cramp her style too much.
Sounds cool, and to show us how it's done is senior physiotherapist Joanne Moore. First, she draws around Ava's finger to make a template.
And you thought you were coming to therapy, not an art class?
Then Joanne takes a sheet of plastic and cuts out a small section.
I need to put it in some hot water, okay? Because that will make it go nice and soft. It's going all floppy.
Now it can be cut to size and finely shaped to fit Ava's hand.
Is it too hot?
No, it's fine.
It's okay.
Awesome. Ava needs to wear this splint for a couple of weeks.
And the best bit is, Ava won't have a stinky hand this time.
Pongtastic.
Bye, Ava!
Bye.
Still to come.
We're in a pickle.
This would basically be disastrous.
Things go snap.
Can you wiggle it?
And we spill the beans.
Ah, my leg!
But first, did you know a sneeze is faster than a cheetah? It can travel up to 100 miles an hour.
Wow, bless you.
Amazing people do lots of important jobs inside and outside hospitals that help to keep you safe.
But what will happen when we have a go? My problem now is that I'm stuck.
This is Operation Takeover.
Can you guess who today's hospital hero is?
Well, here's a clue. They work with these. Can you guess it? We're about to take over the job of today's hero, pharmacist Emma.
Emma is one of 37 pharmacists organising the medicine at Alder Hey.
So as doctors, we've written thousands of prescriptions. They come up here to pharmacy, but what happens to them next? Emma?
We'll make sure that all the information is on the prescription that we need to get the medicine to the child.
Looking around us, there are hundreds of medicines. How much do you know about all of them?
So we know what the right dose is, we know what each of the medicines contain and what they can be used for.
I always thought doctors knew lots about medicine, but actually pharmacists know much more, don't they?
Yeah.
Okay. Not so clever after all.
No.
A pharmacist's job doesn't stop in the medicine room.
Hello, Grace. My name's Emma. I'm a pharmacist on the ward.
They also deliver the medicines directly to the patients, passing on their knowledge and advice.
What do you lot think of the pharmacists?
Because when the pharmacists come in, they're nice and kind and helpful.
And she explained, what's going on in my tummy. And they are hard work people.
Thanks, everyone. There's a lot to live up to.
We've seen just how important pharmacists are in helping to make you feel better.
But will our careers as pharmacists be a bitter pill to swallow? Get it? Good, eh? Get it?
It's time for us to take over as pharmacists. Our challenge is to successfully prepare 3 prescriptions and deliver them to the eagerly waiting patients and staff.
Yep, but I don't think Emma has much faith in us. The prescriptions are fake, they've given us coloured beads instead of tablets, and the medical names are a bit suspect.
Snototrexil? Burpamol? She'll be judging us on 3 things. Number 1,
Fill the bags with the right medicines in the right quantity. Also to make sure that when you do hand the medicines over that you give the correct advice.
Phew. Xand, you're up first.
Burpamol, twice a day with food for 7 days.
2 times 7 equals 14.
Salivation, 11, 12, 13, 14.
Watch and learn, Chris.
Burpamol,
Hot on your heels, Xand.
13, 14. Salivaton, 12, 13, 14.
This is easy.
Snototrexil, 3 times a day for 3 days is 9. 3, 4.
Oops, I think a few extras went in there.
Well, let's see if you do any better, Chris.
6. Oh,
Nope, didn't think so.
I'm sure it'll be fine. I mean, maybe I shouldn't be mixing the pills in the same bag.
We have both failed at that prescription. Hopefully the last one's a bit easier.
5 days of Burpamol. OK.
We have got the patients waiting on these medicines.
I know.
Come on, Xand.
10 pills.
There are patients waiting.
9, 10.
I'm off to the wards.
Right behind you.
Jack, Nurse Katie and Kieran are all still waiting for their medicine and the very important pharmacist advice.
Is Jack here? So I'm Dr. Xand. I've got Burpamol and salivation for you. We might have to let Mum have that, actually. I should have given it to Mum. Oh, well.
Not going to give any advice then? OK.
Is Jack in here? So you've got... This is where I'm in trouble because I've forgotten if the green one's a Burpamol. Do you know what colour Burpamol is?
Ha! Epic fail, Chris.
I'm going to have to take this prescription back to the pharmacy. I feel a bit silly.
On to the next one for me.
I'm looking for Katie, and I have a prescription for you. So this is meant to be for Snototrexil and Pusiloxate. And I'm missing a bag. Oh, hell no. What I have now is a bundle of bags and a bundle of prescriptions. It all looks the same. I have no idea which is which. This would basically be disastrous. Chris, I've messed up. I've bundled up all my bags and all my prescriptions. I don't know which is which.
Why didn't you do that?
Oh, I tied little knots. I tied mine like party bags. I might have to go back and get the one I've given out.
That's it. Xand's out. Disqualified.
You're the last man standing, Chris.
Is Nurse Katie here? I've got a prescription here. It's for Snototrexil and Pusiloxate, but I put all the pills together in one bag. And you don't know which colour Pusiloxate is. And you don't just want to have a guess and hope that it all turns out well.
Surely he should be disqualified too.
Wait. I have one last chance to redeem myself. Kieran, so this is your Burpamol, which you have to take twice a day with food for 5 days. So I'm going to leave them with you. Bingo! That's one accurate prescription with the right medicines delivered to the right patient with the right advice. Thoughts, Xand?
I think you got lucky, but only Judge Emma can decide.
Xand started really well, but he muddled up all the bags and he actually left the medication with the wrong patient, so he's disqualified. Chris spotted his mistakes before handing any of his medicines out, and he actually even managed to get one prescription correctly to the right patient.
OK, so who's the winner, Emma?
Dr. Chris, you just were slightly more organised.
Yes! Victory!
That is not a triumph.
A career in pharmacy awaits me.
I doubt it.
Well, I think we've both learned today how important the job of the pharmacist in the hospital is.
And I think it is definitely best left to the professionals.
Have the prescriptions back.
Have the pharmacist codes back.
Thank you.
And now to our lab, but this time we've hidden it in a top-secret location.
So secret, in fact, that even Xand doesn't know where it is.
Wow! Well, anyway, it's time for some amazing experiments. Just don't try anything you see here at home.
Today, we're looking at your eardrum.
Xand, what are you doing? You know there is no trampolining allowed in the lab.
Yes, I know, but I just thought...
No buts, Xand. We have an experiment to do.
Yes, I know, which is why...
Xand, could we please get on with the experiment?
All right. Today, we're going to be hearing about one of the most amazing pieces of body kit you've got.
Your eardrum.
Wow!
There's nothing there.
No, it is there. Right there. See?
Oh, yeah.
Now, this one is from a pig. It's similar to yours, but yours is actually a bit bigger. It's called the tympanic membrane, and this is the amazing piece of body kit that vibrates when sound reaches it, allowing you to hear.
Let's see one in action.
Now, I'm going to use this endoscope to show you my eardrum.
Now, remember, we can only do this because we're doctors. You should never stick anything in your ears.
If you have a look on the screen, you can see that's my ear right there. You can see that very clearly. And then that goes into the ear canal, and that's lined with a few hairs, a bit of wax, and then that right there, that is the eardrum. The eardrum is only 1/10 of a millimetre thick. That is 5 times thinner than a sheet of paper, and yet it's incredibly strong. And if I hold my nose and blow...
I can make my eardrum pop. Look, you can see it's really stretchy.
Well, this part actually works a bit like
a trampoline! That's why I brought it in. Anyway, let me get the trampoline. Now, the bit of the trampoline I want you to look at is the bit that you jump on, the net. It's made of lots of elastic fibres that crisscross, and this makes it stretchy, but also very strong.
And the middle section of your eardrum is also made of lots of criss-crossing elastic fibres, this time of a protein called collagen. Some crossing in lines like the spokes on a wheel, and some arranged in circles. So it's also strong and stretchy, just like the trampoline.
But how does your eardrum help you to hear? To show you,
we have this. This is a Rubens tube, and it can show us what sound, which is normally invisible, actually looks like. If, for example, someone was to sing...
Sing? This is my moment!
OK. Well, when Xand sings, the dreadful sound that he makes travels through the air in invisible waves, and if you're unlucky enough to be near him, they go into your ear. With the Rubens tube, we will be able to see the sound waves as fire. OK, Xand, take it away. Now, the sound that Xand is making is amplified at this end, and sound waves are then sent down the tube.
So if you could see sound, it would look like this. A wave of high, and then low air pressure.
OK, Xand, I think that's enough. So the Rubens tube shows us that sounds are made of waves of air pressure. But to understand how those waves get sent into your brain, take a look at this. This is a model of an eardrum. So your ear would be there, sound comes in through the ear canal. This is the eardrum.
And this represents the ossicles. Remember, that's those 3 bones, the hammer, the anvil, and the stirrup, that help transmit sound into your brain.
So now we're going to make some sounds, send them into the ear canal, and you will see what happens to the ossicles.
And Chris, I've queued up your favourite tune. Take it away! Now the sound waves travel through your ear into the ear canal where they hit the eardrum. This is why it's strong and stretchy, to cope with being bombarded with sound all day long. Let's see it in slow motion. Look how the ossicles, the green bit, is bouncing about. It's being moved by the vibrating pink eardrum. Cool! The ossicles are what transmit the sound into your brain so you can hear the amazing music.
So we've shown you what an eardrum looks like and how it's made of strong elastic fibres, just like a trampoline.
And we've shown you how your eardrum works, vibrating as the sound waves reach it so you can hear.
Your eardrum is amazing, and that's why you have to look after it. So you should never, ever stick anything in your ear that's smaller than your elbow.
I'll say it's harder than you made it sound. Can I borrow your elbow?
That's better. Let's head back to accident and emergency
for another curious case.
Arriving at Alderhay with her dad is football fanatic Lily.
I play for 2 teams.
2 teams? Xand couldn't even get into 1. Oi!
What's with the sling?
Lily was playing a cup game for her local footy club. As always, she was on top form.
She shoots and she scores!
But the goalkeeper hadn't turned up, so Lily went in goal. The match ended 2-2 and it went to penalties.
It's a tense game, Chris. It's going right to the wire.
The opposition were ready to take their first penalty.
It's a high shot to the top left corner.
Lily reached to save it.
When all of a sudden, the ball bent her hand backwards. Ouch! Ooh, Lily, why not try something safer like a crossword?
I like football a lot.
Are you sure? Even more than crosswords?
A lot.
OK, I believe you.
Emergency nurse practitioner Nicola Evans is here to get you back on the ball.
So we're just going to have a little feel.
Nurse Nicola examines Lily's arm to explore the twist in her wrist.
What about when we lift it up?
A bit on that side.
OK, to the side.
There.
Right.
With Lily in pain, she's sent straight to X-ray.
That's sound underneath.
So that's your X-ray. We've got a little crack there. She's broken her radius, which is the big bone in her wrist.
Uh-oh, it's a red card for Lily's radius.
So you won't be playing in the school final?
No.
Oh no, Lily will be on the bench for a while.
Time for a temporary cast so the swelling can go down. But there's only one thing on Lily's mind.
I'm going to miss the final now.
At least your arm's going to get better.
Wise words, Dad. She'll be back on the football pitch before she knows it.
Bye, Lily.
Your body is amazing, but sometimes it needs fixing.
In some cases, the only way to do this is with an operation.
Did you know that 27,000 operations happen in the UK every day?
Now, some of these are minor and happen in clinics or in accident and emergency, but for bigger operations, you have to go to surgery. And that's where I am today.
In the theatre at Alderhay, there are surgeons, nurses, but who's this person? That's the anaesthetist. It's his job to make sure you don't feel a thing during an operation.
And they're a vital part of the team in any operating theatre because they put you into a special kind of sleep that means you don't feel any pain and you don't remember anything at all. So what is an anaesthetic and how does it work?
There are 2 types of anaesthetic, a local and a general.
A local anaesthetic numbs just the injured area of your body so that the pain signals sent to the brain get blocked. You might have had one of these when you've had a filling at the dentist or a couple of stitches.
And there's a general anaesthetic, like Mini Chris had earlier when he cut his hand. This is a combination of medicines which you have as an injection or as a gas that you inhale, and it makes you temporarily unconscious.
This is anaesthetist Dr. Will Gauntlet. He's going to give 11-year-old Kieran a general anaesthetic for his ear operation.
So, when was the last time you had anything to eat?
Well, before 8 o'clock this morning.
When we go off to sleep, we want you to have a nice empty tummy because the last thing we want is any burgers and chips to kind of back up and make a reappearance when you're asleep.
It's a good job Kieran hasn't eaten anything, because with a general anaesthetic, your body doesn't function normally, and a full stomach might mean food gets stuck in your throat. Kieran's given an injection and anaesthetic gas to send him to sleep. It takes him about 2 minutes to be fully anaesthetised.
Now, Dad, he's probably ready for an embarrassing kiss now.
Don't make it a sloppy one, Dad.
And you've got special plasters to keep his eyes closed.
So we put some tape over the eyes so that if any dust does land on them, that it won't risk scratching the eye while he's asleep. We're all ready now, I think, Terry.
The operation can begin, but the anaesthetist's work isn't over yet. Now Will's job is to keep Kieran safe while he's in the operation, making sure he's getting lots of oxygen into his lungs, but also that he doesn't wake up. Dr. Will has this amazing machine to help him give Kieran more anaesthetic during the operation if needed. How does it work?
We've got our anaesthetic agents kept up here. We have pipes at the back here with oxygen. And as it goes through the machine, it will pick up like a whiff of that anaesthetic gas and then out through the pipes off to Kieran.
What then is this pump thing? Is that breathing for him?
This is a ventilator, and every time Kieran takes a breath, the machine gives him a little extra air, just to make up for the fact that under anaesthetic, his breathing's not quite as strong as it is when he's awake.
With the operation over, it's not long before Kieran is back on the ward. Thanks to the awesome anaesthetic, he has no memory of the surgery.
Do you remember anyone putting anything in your ears?
No.
And did any of it hurt?
No.
So that's pretty good, isn't it?
And there's one surefire way of finding out if Kieran is better.
So what's your plan for dinner?
Hamburger and chips.
So if you ever need an operation like Kieran did, then you don't need to worry about it being painful, all thanks to the amazing anaesthetists and their general anaesthetics.